water, and do not take a lot of fruits because the fruits, they are rich in potassium, okay, especially for patients who have kidney disease. Is garlic, ginger, and guyabano. So garlic, ginger, and guyabano leaves. So what I do is that as many as you can, okay? Kung kaya nyong i-blenderize, if you can do blenderization, you do it, okay? But if you cannot, you can also boil it. Boil and then drink. Okay, garlic, ginger, and guyabano leaves. So those are my basic herbs, okay? Now, it depends. If you have diabetes, so you can use, in addition to that, you can use serpentina or insulin plant, okay? Now, if you are suffering from chronic kidney disease, Dr. Farrah protocol says you have to take baking soda. So 1 teaspoon 3 times a day in a limited amount of water, okay?
May help.
This may help. Okay, so CKD, baking soda, 1 teaspoon 3 times a day in a limited amount of water, and do not take a lot of fruits because the fruits, they are rich in potassium, okay, especially for patients who have kidney disease. Hindi pwedeng tumaas friends, I'm sorry.
Friends,
so especially for friends who have say a chronic kidney disease, if your potassium increases, you will have a heart attack. So, pwede ko kayo magkaroon ng atake sa puso. You can have heart attack. So, it's better not to take in a lot of fruits, or always check your potassium if you have kidney disease.
Always remember.
Okay? What about to lower creatinine level? Okay. So, if you have a creatinine problem, again, the one that I usually do is that I let them drink baking soda 1 teaspoon 3 times a day. Okay, and you have to be careful with your fluid intake because if you have chronic renal insufficiency or if you have chronic renal failure, okay, you might have congestion. Okay, so it's going to be very difficult for you to excrete water.
Kidney stones, how do I dissolve it naturally? In the Philippines, we have this plant, we call it sampalukan, and it's very good. It's a stone breaker. But since I don't know if you have any idea how it looks like. The best thing that you can do is horsetail tea. You have to drink that like every. Some of my patients, I tell them to drink it, or some of my clients right now, I tell them to drink it like every 2 hours, and then to drink lemon juice.
Horsetail tea is available on Amazon.
Yeah, so lemon juice, okay, lemon juice, it's rich in citric acid. You know, some doctors, they actually prescribe a medication for for dissolving stone. It's called potassium citrate. And you have that, you can find it in lemon juice, which is citric acid. It will dissolve the stones. And of course, magnesium, okay. So magnesium will bind, okay. So will bind with the salts, okay. And when magnesium binds in the salt, they don't form stones, unlike calcium. Okay, so we'll do an experiment. You want to do an experiment, honey?
It's probably going to involve me drinking something that tastes like crap.
So, in a piece of, you can do it. Actually, you can do an experiment about it. Like in a glass of water, you put their calcium, and then you dissolve magnesium on it. You dissolve magnesium, and it will not form stones. That's how good magnesium is. Okay, so magnesium, horsetail tea, lemon juice, okay, baking soda, they can also be good because it neutralizes the acidity in the body. Because the stones, there are many, you know, there's uric acid stones, there's calcium oxalate stones, and of course you have to be careful with the food. That's very, very important. Okay, you know, all of our problems will be gone if our food is is excellent. I mean, the soil, it's all properly fertilized.
High blood pressure, Mom.
Yeah, I already answered magnesium.